Ready, Jenny?
I am ready, then wait.
Good afternoon. I'd like to call this special meeting of the Board of Supervisors to order. This is August the 20th. And Madam Clerk, if you could do a roll call of those on the telephone, please.
Supervisor Johnson?
Present.
Supervisor Gould?
Here.
We are ready to go.
Okay, thank you very much. The one and only item on the agenda today is a discussion on possible action, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19, and taking any necessary actions based upon these updates. So I'll turn the floor over to our Health Director, Denise Burley.
Madam Chair, members of the board, I am aware that Governor Ducey will be conducting a brief media update at 12:30 today, so I'll be mindful of my presentation time to assure that you can attend that and participate in that if you wish. So I also don't want to cut the meeting short if there are questions, so we'll balance that along the way, and you can let me know when to cut that off, okay?
Okay.
We can always address some of these topics on Monday if need be. So we'll go through the numbers. We have 3,384 cases in the county to date, 2,161 recovered, 179 deaths. The average age of cases is 48.3. Average age of deaths is 76.3. Provide an update on case investigations. Total cases, as I mentioned, was 3,384. We've completed 2,434 investigations. We have 738 that are active and 212 that are in process, meaning we may be waiting for data entry, may be started, and we're staying up to date on those as well. Those are maybe recent cases, and they're being assigned to those investigators, and they'll follow up as quickly as possible. And those are, of course, first on our list, and usually contacted within a day of receiving that case information. We do have assignments identified and given on weekends. Some investigators are working on the weekend, and that seems to be flowing very well. The case investigators are now monitoring cases that they interview, which is a preferred track anyway, because they've already built the relationship through their conversations with those particular cases. And that seems to be going well at this point. It doesn't seem to be overwhelming. Any questions on case investigations and contact monitoring or contact tracing, contact monitoring?
Any questions?
I have a question, Madam Chair.
Supervisor Johnson, go ahead.
I was contacted today by a person who, let me see, I'll get to what they told me so I can exactly quote them. I have COVID-19. I was so careful. I'm upset. So damn sick since the night of the 12th. I'll be safe. I went to the hospital on the 16th with 102 fever, freezing to death. Put me in the COVID unit. No one has asked me where I got it. I know where, but no one asked me. So if we're doing this, how come nobody's contacted this person?
If this person is in the hospital under the care of the physicians, I need to check on that, Supervisor Johnson, to understand that process better about when our investigation starts for those individuals that are being in the hospital. Is that person, do you know, still in the hospital?
Yes.
Okay. But I will check on that for you, and I'll email you back an answer as soon as possible.
All right.
Thank you.
Any other questions? I see none, Denise.
Okay. All right. School benchmarks. On Monday, I believe we sent out some graphs to you that were also sent to school administrators to help them make some decisions based on how to re-enter back into the school setting. We did receive some feedback from at least one school administrator that they really appreciated that information, and we'll continue to provide that as we can. We're looking to try to update that every week, and that pushes the data out a little bit and gives them more local data. And hopefully we can meet that demand and get that out to them. But I'm happy to report that that was well received, and I think it's helpful for them in their local areas to make those decisions about traditional on-site learning, and hybrid model learning, and then virtual, of course, and how they're doing that. I was just on a call with many of those school administrators, and they were talking about what their plans are moving forward. There's sort of a mix of decisions along the way, and I think they're basing it on the best information that they have available and the plans that they have in place to mitigate any spread of the virus within their settings. So definitely positive. If I could circle back to your question about Supervisor Johnson, we still try to call a case in the hospital. If we can get that information from you, that would be helpful about that particular person. So I can talk with you after the meeting if that's a better time to do so.
Well, I'm guessing that I would think that the contract tracers would have that information.
Right. I think that's why if there's something that's fallen through a gap, we want to make sure that, and we want to thank you for bringing that to our attention, of course, but also get that information so we can follow up. But that'll help us understand what happened, and make any kind of corrections if need be.
Is that all you had, Supervisor Johnson?
At this point, yes, Madam Chair. She asked for questions on the contract tracing, and that's all I have.
Okay. Supervisor Angus, go ahead.
On that note, I just got a text from someone who said that when he was in the hospital, a nurse contacted him at the hospital and the day he got home. So it's not really consistent in what we're doing. And it's the same thing with the tests themselves. And I know that's not really the county thing, because I'm still getting, I'm sure the other supervisors are too, notes that people have taken a test, they were sick, they're well now, but they never got the test back. And so, we never sort of perfected it. And that's sort of the problem in the whole state, and that why people don't really trust the numbers that much. But we kind of do the best we can, and it's that lag time. Another question I just got this morning, between, when we get the press releases, we're already, unless it says under investigation, that means that you just got it in, right? You just got it in.
Correct.
And if it's already been traced and it's connected to another one, but again, there is a lag time between that. So it's being reported to the state immediately, but by the time we get it and Roger puts it out, there is this lag time, which now is translating down to the state and making it difficult for everyone to open up and stuff.
Correct. Another point to make here is that I don't know, Supervisor Johnson, if that particular person and patient is in the ICU, but some of those individuals that are in the ICU were not available they're not available for follow-up at that point. So we will certainly continue to monitor their situation and try to get back with them. Okay. All right. There were a number of questions asked at the last meeting. I thought it best to provide answers during this meeting so that the public could hear those as well. So I wanted to go through those, if you won't mind. First was the question about the CLI surveillance, the corona-like illness, and what is that? So I'll just kind of read the statement that I have here so you have all the information about what that looks like. So unlike counts of cases or tests, CLI surveillance is intended to be an early warning system for communities and hospitals. An increase in CLI rates could precede an increase in cases and hospitalizations. It is not intended to replace the tally of cases, hospitalizations, and deaths that give us confirmed rates of disease spread. It provides the percent of all hospital visits, inpatient and emergency department, that meet the definition of corona-like illness. CLI visits are defined by the National Syndromic Surveillance Program's BioSense platform as certain combinations of symptoms that may indicate COVID-19 disease in a patient. An example is a patient with a fever and shortness of breath. The measure is determined from hospital triage records, the patient's chief complaints, or the discharge diagnosis. Can these counts pick up something like influenza or a head cold instead of COVID? Yes. The algorithm is designed to weed out as many lookalikes as possible, but of course some can slip through. That is why epidemiologists look at the trends up and down rather than an absolute number. So if the system counts a cold last week, it will count a cold when it sees it again this week. But if the number increases, it's not just the noise of colds and other erroneous coded syndromes. So it is about looking at those trends at that point and not the individual cases, although we do want to ensure that accurate information is, of course, entered into the system. And it's all based on the ICD-10 codes, medical codes. So it uses that algorithm at the hospital level to determine whether or not that fits the criteria for that particular, for a CLI. I know that's a rather complex explanation, but I hope that answers your question about what a CLI actually is and what it's used for. Any questions there? Okay. Reinfection rate. There was a question about reinfection. The CDC updated their webpage on 8/16 with some new information and stated that they do not know if someone can be reinfected with COVID-19. Data to date show that a person who has had and recovered from COVID-19 may have low levels of the virus in their bodies for up to 3 months after diagnosis. This means that if the person who has recovered from COVID-19 is retested within that 3-month of initial infection, they may continue to have a positive test result even though they are not spreading COVID-19 out in the community. There are no confirmed reports to date of a person being reinfected with COVID-19 within that 3-month of initial infection. However, additional research is, of course, ongoing on that. Therefore, if a person who has recovered has new symptoms of COVID-19, the person may need an evaluation for reinfection, especially if the person has had close contact with a positive case. So, again, it's just that cautionary note of follow through with your healthcare provider and if you continue to have symptoms. Any questions there? Okay.
I have a question, Madam Chair.
Okay, go ahead.
So what is our response from the county for people who have had COVID? Do they need to not take any precaution?
No, we do ask that those people who have that are confirmed cases actually follow all of the same safety and precautionary steps, wearing a mask, staying home if you're sick, following all those protocols, and being very mindful of wearing that mask around other people when you're unable to social distance. The importance is, we emphasize that probably more so with those that have been positive cases, especially within that time frame. Did that answer your question, Supervisor Johnson?
Yes, thank you.
Okay. The other question was about North Country healthcare testing events in Lake Havasu City and Bullhead City. North Country is planning for 150 tests per event. The test result return time is 3 to 4 business days. The Lake Havasu City event is this Saturday, August 22nd, from 7 to 10 a.m. at the Aquatic Center. I believe there's pre-registration required for both of these events, so I would recommend people go to the North Country Healthcare website. And then the other event in Bullhead City will be Friday, August 28th, from 6 a.m. to 9 a.m. So just some clarification on the number of tests that will be provided during those events and the turnaround time for those test results to be returned. The final question, I believe, was about the business benchmarks. And This relates to what happens if we move from substantial down to moderate. Some businesses, of course, are allowed to reopen under those guidelines and occupancy rates. And what happens if the county numbers degrade and go up after that point? So the state has provided an explanation, and that is that all 3 benchmarks must be met for 14 days with a 12-day reporting lag period to move from red to yellow or yellow to green categories. Similarly, if conditions worsen, the 14-day with 12-day reporting lag period for benchmarks still applies and would then move the category from green to yellow or yellow to red. However, only one of the 3 benchmarks would need to worsen in order to regress to a more restricted category. As you know, it's about having all 3 in a range. So if you have 2 yellows and a red, it still puts you in a red category. If you have 2 yellows and a green, you're in the moderate category still. So I just want to be clear how those standards are and benchmarks are defined and how that movement occurs. They basically have stated businesses are responsible for monitoring the ADHS business website, which is updated weekly, and that's Thursday mornings at 9 o'clock. Same date and time as the school benchmarks, and adhering to current benchmark category restrictions, including closure if benchmarks and category warrant that action. Businesses that successfully obtain approval from ADHS through the attestation process to operate, even when the county is in the substantial red category, if they've gone through the appeal process, will be able to continue operations under the agreed upon restrictions regardless of whether the benchmark category is at a particular time. And the attestation approval certificate should be prominently displayed in a public area. And that way the public and people who are in the business can see. Did that answer your question? I think that was yours, Supervisor Angus, about the process.
Yeah, I understand the process, and I believe that the gyms and the restaurants, they're going through it, and of course there's now hundreds and hundreds, maybe even thousands with the bars and the restaurants. So what started with a 24-hour turnaround is now looking to be more like a week. Is this would be a time to talk about the gym roundtable, or would you rather wait?
Oh, you can talk about it now.
So I mentioned last time that the state was having a meeting, a roundtable on the Senate caucus, this majority caucus, and it was kind of put together quickly. Senator Borelli helped put it together. Senate President Fan presided over it, and Mojave County was very well represented. We had gym owners from every city. They're all different kinds of gyms, and so that the bottom line, what they were arguing was you're looking at these gyms as an industry instead of, specific businesses, because a gym isn't one thing, right? It could be a yoga studio, it could be huge, it could be small, walk-in, no employees, and so they were kind of angry at that, and sort of angry about the malicious, I don't want to say malicious, but so the stigma that they're one of the only industries that are still closed, the message that sends to the customers about the cleanliness, and I think all of these are very valid, but they listened very carefully. There was no representative from the governor's office, but they did say that they were going to now all talk to the governor's office about it. Our problem right now here in Mojave County is that our positivity tests are artificially high because we did not do the kind of blitz testing like you talked about earlier that the other counties did. And again, I think that is unfair because the state didn't send them like they sent to others. I don't know why. I personally was against them, but I didn't stop any of them. If we had known that was going to be the marker for reopening, and maybe it always was, and we weren't told. So now it's kind of this mad rush to get these blitz testing, and 100 here and 100 here is good, but we need thousands just to catch up just to catch up with the other counties. I mean, Little Graham County has like twice the amount of tests that we did. And so you're seeing these gyms and bars opening up across the state, but not here. And that's a real problem. And I'm talking to people at the state, and I hope all the supervisors do, so we can at least be on an even playing field, or else with all this lag time, we're never going to be able to open up 100%, and businesses are going to go out of business. So I think we're at sort of a crisis period here.
Understood. So, and that's a great segue into the next topic I wanted to discuss, which was about testing. So as I mentioned before, HHS is offering the opportunity for blitz testing to occur within our county. And so we are meeting and discussing the options with leadership of the 3 cities, main cities. So the goal of completing 1,000 tests in each community within a 1 to 3 day time span, and to try to organize and coordinate that work with HHS, looking at city resources, county resources, as far as staffing and needs, equipment needs, and so forth. So we do know that we learned this morning that we need to commit to that testing by the end of the day today. So we are working again with those city leaders to talk about yes, no, are you in, are you out, and looking at the dates that can occur and locations that can occur. The locations are not as critical at the moment, but the commitment is. So we want to make sure that we can open that up. We're also aware of Embry Women's Health working with Mojave Community College to offer testing in Bullhead City, Lake Havasu City, and Kingman at their campuses. That testing is not just for students and staff. That is open to the community. It's free. HHS testing is also free. And they provide all of the staffing, Embry Women's Health, if they come to these communities and do the testing at these sites, they provide all the staffing that's needed, and all they've asked of us is to promote their services out there. And there's no specific criteria for those individuals. That can be anyone who wants to be tested can sign up to be tested through the Embry Women's Health. I also want you to be aware of the Wildland Firefighter testing. As you know, we've got a fire up in the Wallapies at the moment. We've received 500 test kits that are designated by ADHS and approved for testing at the Arizona State Public Health Lab for those crews. So we are transporting 50 of those kits up to their incident command center at the BLM office. And they can actually, because they're a nasal test, they can actually perform and collect the specimens. They don't require a nurse to do so. So they will be testing themselves and then contacting us when specimens need to be collected and picked up, and then we'll make sure that they get down to the Arizona State Lab. So that's another aspect of testing that we'll be working with BLM and the firefighters to try to protect them.
Very good.
And finally, we have just a quick update on the Operation Warp Speed at this time, and that's for vaccine trials, as you remember from the previous meeting. What we know at this moment is that there'll be a trailer placed somewhere in Tucson, I don't know the exact location at this point, for the Moderna vaccine trial. And then there'll be 2, one in Phoenix, one in Scottsdale, for the AstraZeneca vaccine trials. And those are all slated to begin, I believe, sometime in September, October. So as we learn more information, of course, I'll provide that out to you. And that is what I have for an update, but I'm absolutely ready to answer questions.
Okay, thank you, Denise. Does anybody have any questions? Supervisor Angus, go ahead.
Just a real quick comment. So today's Thursday, so the numbers from the state were refreshed today. Do you have that?
For the schools and the businesses?
Yes.
Yes.
The positivity?
Yes, percent positivity still continues to be our one substantial category for both schools and for the businesses. Yes.
And what is the new number?
Pardon me?
And what is the new number?
I'm sorry, I didn't have it quite that available. I did intend to print it out.
Because the last week, it was at 18.6, I believe. Is that it? So I want to, this is now, we're still behind.
Correct.
Because that hit our really peak time between July 24th and August 1st. So I'm hoping that it's come substantially down, and I still don't think it's as low as it should be, because the last week or so, we've been pretty okay. So you don't have that
We've
number?
made significant improvements. Sorry, I'm looking at their website right now, looking for their dashboard for schools and businesses, which are in a different location. There we go. And are you specifically looking at the business dashboard or either one?
Either one.
Okay.
It's the different numbers? Why would it
Well,
be different numbers?
There's one different piece to the business one, and that is that they look at cases per 100,000 versus a decrease in cases. So the schools have two options there, a decrease in cases or cases per 100,000 population, and businesses is only cases per 100,000. So I just want to make that clarification there. So if I look at the Mojave County, and this is for the businesses, we're in the moderate range for cases per 100,000 individuals. We moved down below that. Our positivity is still substantial, and it looks like as of August 2nd, we went up a little bit to 13%. We were at 10.7% prior during that week. And the hospital visits for COVID-like illness are in the green. So we still need to work on that percent positivity piece.
You sure that's correct? Because that's not what I got, but we'll look on that.
Yes, please do. I mean, I just pulled it up from their website, so unless, yeah, 13% as of August 2nd for Mojave County, up from that 10.7.
Denise, I have a question and a comment. I've had more than one person contact me via text stating our math is not correct on our news releases and our fact sheet. And so I looked at the fact sheet, and I think I see what they're referring to on the number of confirmed cases. We have 3,384, and then when you go down and you add up the cases by community, the numbers are about 252 off.
Right.
So is there an explanation for that discrepancy in the totals?
Right. And I do believe what I remember from my conversations with staff is there are some unknowns, and we can add those categories in to make that more clear. The unknowns, when we have unknowns, to actually place them into the count to help that math add up.
I think if that's important to the overall understanding, because there's so much out there that people are not trusting the numbers, and when we're putting out numbers and they don't make sense on our information, maybe that would help develop a little more trust.
Oh, sorry, and the other thing that does not include is tribal cases. So we do not report tribal cases, and so there may be a number of them, and we can put a disclaimer if that's helpful at the bottom of that chart that indicates that we do not include tribal cases in that count.
Is the tribal cases then counted with the number of confirmed cases overall, but then not as cases by community?
I need to just check into that,
Okay.
if you don't mind.
Okay, and then in Roger's latest news release, there's some problems with the math there too, but I can get with Roger on that later. I think that's more just a couple typos, but those numbers don't add up either. So.
Yes. Oh, yes, the tribal cases are included in our confirmed cases.
Okay, they're in
So
the confirmed
numbers are
cases,
included
but
in
they're
the
not
total
itemized.
confirmed cases, but we're unable to break them out as tribal cases and report them.
Okay, maybe it would help if we just put a little note in there.
Certainly.
Okay. Does anybody else have any questions?
I do, Madam Chair.
Okay, Supervisor Johnson, go ahead.
Thank you. One thing that we were talking about previously about getting more testing, I think we've sent out mixed messages, because to begin with, everybody kept saying, oh, we're doing more testing, that's why we have high numbers. And so I'm not sure if that's why we didn't do as much testing. But now we're asking people to test more, and people aren't believing our numbers or believing that they should get tested because it's taking so long. Are you seeing that at the health department?
The testing time frame and turnaround time has improved greatly from a month ago. I think you knew that there were sometimes 7, 8, 10, 12 days before people would get their results. My understanding is that's been corrected and significantly improved, and so the 3 to 4 day time frame is pretty consistent across the board for at least receiving those. And I think what's helpful to know when we can offer testing out in the community is looking at offering testing to those individuals that may be close contacts, that may be working with vulnerable populations and specific groups that would help, again, identify those that are working with at-risk people. And also those that have been around a positive case in those close contacts, we can certainly identify them maybe more quickly than we do otherwise waiting for those symptoms. Granted, with that said, I realize that symptoms are generally our indicator that someone needs to be tested, right? That's going to come back with a potentially confirmed case. So I understand your point about mixed messages, and I think that in looking at testing overall, it would be helpful not to inflate or deflate numbers, but just to offer more testing in the community for those individuals who feel like they're being screened out of a process. And that's
correct. I think we need to build up the confidence that people have in the testing. Also, when you were going over follow-ups, you mentioned Monday that we would be having an update that evening regarding Lake Havasu and Bullhead testing. And while I got the information from the city and the public health meeting, we never were notified. Is that being taken care of so that the Board of Supervisors is notified of all these things before it goes out?
Yes, I'm sorry. And I was actually informed of that. We weren't part of the planning process for those particular events. So as soon as I learned of them, I put them on the agenda. If it would be more helpful, I can certainly share that information as soon as I receive it and make sure that I do not wait until a board meeting to provide that update.
All right. And I asked at Monday's meeting about public health. We'll be counting the COVID patients who are snowbirds. Have we got an answer to that?
So the snowbirds, it's really about where they report their permanent address. And that goes back to whether, how cases are assigned to our county. Excuse me. And so if a snowbird puts a permanent residence down as our county, then we will be the assigned county for that particular case if it's confirmed, and do all the follow-up. If that is a confirmed case in a different jurisdiction, that case is moved out of our county. It doesn't mean that we won't assist that other jurisdiction with the investigation and the contact tracing, because those people are local, potentially local here, but it just means the case is officially assigned to that other jurisdiction.
All right. You told me we would start asking about people's professions in your questioning during the...
Correct.
Have we done anything with that so far?
We have. That question was added to the investigators worksheet, and if you'd like, I can try to see what information and data we have available to date and report that on Monday.
All right. I was reading a scientific study the other day on SARS and the new coronavirus, and it was saying how we are seeing similarities between the two viruses when it comes to long-term side effects in recovering patients. Is the health community having talks of what these long-term side effects could mean to people's quality of life?
I do believe a lot of that research is still ongoing, and I'm not sure if they're having those conversations at a local level or just reporting that information back, and that's being compiled on a state and federal level. But I can certainly follow up with that as well.
All right. The FDA has paused the emergency order for plasma treatment. Have you heard about this? And can you explain it? It's my understanding that the Lake Havasu Regional Hospital was using plasma treatment at one point to try and treat COVID patients.
I was not familiar with that, Supervisor Johnson, so if we could talk offline and you could share a little bit more information with that, on that with me, and I'll make sure that I follow up.
All right. It is my understanding that we have a person who is responsible for the health department's Facebook page. When folks are asking reasonable questions, how come we're not giving them answers?
Let me follow up on that as well.
All right. Did you ever get the list of labs who are not reporting patient information?
It was actually labs and several providers that were not following up and getting all of that information. And some were, I think all the labs were at least partially responsible for that lack of information. And I can get you the names if you'd like. I do have them available.
All right, yes, I think that'd be helpful to all of us. Last night you reported we had 11 atypical cases in the Kingman area and information was unknown on them. You kind of went over that story. Is there a reason we don't have ages on those people?
We are getting the ages, but because of the testing and the reporting process, we haven't gotten the ages from the location yet. So our nurses are working Go ahead.
Okay, so we listed 11 cases that we have no idea their ages or how they got infected.
Well, yes, correct.
And we don't know how these people were connected at all, or if they were connected. Was it family members, friends, a church?
We do know that they're connected. We just can't name the facility that they belong to.
And so you can't let the board know that information either, because we had to sit here and try to answer those questions last night when people were asking us if we're just total idiots and don't know what's going on.
I understand that concern, Supervisor Johnson, and I did take steps to learn whether or not we could share that information with you last night. As a matter of fact, that's why the report was a little bit later than normal. And we were not given permission to share that information, whether it was the type of facility or the facility itself.
I would be really interested in getting that information to the board on who is saying that the board is not trustworthy enough to know this information, because if information is being withheld from the board, we have a county ordinance about lying to the Board of Supervisors. Mm-hmm. And if you had that information and didn't pass it on, I believe that falls into that category. On Monday, we reported we had 3,326 cases, but on Sunday, we reported 42 cases more, with no press release that day to explain anything to the public. I'm afraid we have lost the trust of the public. We need to explain to the folks to clear and easy language why this has occurred, and it really needs to happen immediately. The board is never informed either of why this happened, and I do not accept that. We're 5 months in, and you're telling me we still cannot get accurate data from labs, or is that our failing? Do we need a private investigation into this to find out why we can't get accurate numbers?
Well, the state controls the lab reporting piece of it. We do not. So we can certainly, of course, emphasize our concern over the lack of reporting or the reporting that's being done by the labs, but we don't control that aspect of it, that factor. So, I mean, we don't have a lot of authority to do so.
All right. right. With this new reporting scheme, it's very confusing to the general public and the board, or at least to me. If we take out the probable cases and only count the confirmed cases from the state, we have 3,414, but we have 3,384. That is a difference of 30 cases. Why are we not going off the state numbers?
For confirmed cases,
Yes.
I will check into that.
The percentage positive listed on our website, is that overall percentage positive or weekly?
The percent positive, percent of population with COVID? Looking at your numbers,
That's what we
are you
don't
looking
know.
at the lab PCR tests, percent of all tests that were positive?
Yes.
So those are all electronic records, medical record, lab records, and the percent of positives there for our county, PCR only.
Okay. On our COVID fact sheet, we're breaking down cases by communities, but on our website it's broken down by service area.
Yeah.
So in one place it says Lake Havasu has 1,030, and another place it says Lake Havasu has 1,057. We either need to break it down by community on everything, so it's consistent.
Right, I agree. I noticed that this morning, Supervisor Johnson, when I looked at the webpage and saw the discrepancy there, so.
Okay, and we talk about the Indian nations. Now, when you're breaking down the Kingman area, I'm guessing a lot of the cases in Kingman come from the nation because they report their cases.
Correct.
I'm not seeing, if you can give us a reason in black and white from one of our outstanding attorneys as to why we can't report this, I would be interested in seeing that. You're reporting everything else, but all of a sudden we're counting the Indian nation, but now we can't report the Indian nation. There's no secret if they're having a breakout there. I mean, we have to handle that breakout, correct?
Correct. That's correct. They handle their own cases, so they do the investigation and contact tracing on their own cases. But we, in terms of reporting, that guidance and direction came from the Arizona Department of Health Services that we are unable to share that information on a tribal level. I can certainly work with...
Who gave the Arizona Health Services that authority to tell us that?
That is not a question I have an answer to, but I can certainly work with County Attorney Esplin to learn more about that.
Thank you. When are we doing our cutoff now for our count?
It's noon. So noon the previous day to noon today. So that report was pulled 45 minutes ago, and we'll be reporting that out as soon as it's available.
Is there, I guess, is there a reason we're not going with the state?
Well,
They cut off 5.
originally, Supervisor Johnson, our numbers haven't matched the state for a while, of course, because of the probable and confirmed cases and so on. So when we look at numbers, we're reporting a 24-hour turnaround time on all levels. So, if the county wanted to move towards that time frame, that would be a cutoff time of 5 o'clock for the state, and then they report out the next day.
Okay, I thought that is what we brought up and discussed 3 separate times and finally voted on so that the board would have a press release every night to give us that information. I guess I would make a motion again that we revert to or continue to have the nighttime press releases that shut off at 5 o'clock. That would be my motion, Madam Clerk.
And I'll second that.
Okay, we have a motion and a second. Any discussion? Madam Clerk, do you have the motion? Okay, Supervisor Watson.
Denise, if you're trying to include the numbers up till 5 p.m., how long will it be before a viable report can be put out?
We're probably looking at 6:30, maybe 7, depending upon the report.
So we're adding a number of overtime hours to a number of staff people in order to get 6 hours worth or 5 hours worth of additional information?
Correct. Or in some cases, if we're able to, we will ask that staff person to flex their time to start later in the day. And so,
And I have a hard time seeing the difference between noon and 5 p.m. Our numbers are over 3,000. Our deaths are over almost 200. And it seems a little empirical link for this 5 hours to be so important that we're adding additional time and obligations to people that it's going to be reported in the next 24 hours anyway. So, but that's all I have to say.
it looks like 7 o'clock would be the earliest time that we would be able to get that report.
Thank you.
Madam Chair,
Supervisor Johnson?
the Supervisor Watson's question, that's the way we've been doing it, Supervisor Watson, the whole time. It'll continue to be the same information. I don't see where, it's not like at 5 o'clock they get a bunch of new things. It's just a cutoff time for the state, so they could be getting cases in all day long. Now, there could be a change when, maybe there are some that come in right at 5 o'clock. We have to rely upon the state, but I don't see the problem, and it hasn't cost us money in overtime in the past, so I hope that answers your question or why I'm pushing for this.
Supervisor Angus?
Denise, it's the difference between 12 and 5. How about the newspapers? So does it put us one more day behind if we change the way we do it? Because it's behind anyway.
Right. And I would need Roger probably to speak to that more so than he would be able to do that. At this point, and the cases come in all day, all night. So, that's just part of the new lab reporting process now because they've improved it so from original. We could, with the poll at noon, it does allow us to actually get that information out earlier in the day if need be. So, and it does become about the timing of when we send you, for example, that daily summary and what is used for Roger's press release, and then the fact sheet, and the timing of when we release that to you, and the summary, and how that interplays with information getting out to the public through the various sources. So, Roger, do you have?
Yeah, I would like to hear from Roger, and my thoughts on this while Roger's coming forward is, if we keep changing back and forth, it makes it look like we can't come to a consensus or really don't know exactly how to do this. So, Roger?
Well,
I'm interested
I would
in what you
only
have to say.
speak to the press releases themselves. And there's an immediacy about them that I think is important in the way they come across to the public and to the media as well. I think sending them out, roughly, we've been sending them out around 6 o'clock. That's been the average, I would think. Sometimes a little earlier, sometimes a little later, when certain things may not go right, like they did yesterday. But I do think that that's what the media wants for certain. I think that's what the public certainly is used to by now. I feel strongly about it. I didn't want to address this issue again like I did, the last time. But I think that's very important to keep it as is, if possible.
Okay, any questions for Roger?
Madam Chair,
Yes, County Manager.
just want to refresh our minds to where we've been on this issue. We started with at least as far as I recall, and since I've been on board, we were reporting the 5 o'clock cutoff hour, but that report was coming out anywhere between 6:30 to 8, maybe even 8:30 at times, depending on when our attorney looked at it and was okay with it to be released. That in itself presented a challenge to board members. I heard repeatedly that that report was coming out at dinner time, and why did it have to be that late, and why couldn't we do it differently? So we set out to change and balance between the time of day that we can provide it to the board and release it to the media in time that it works for their news cycle and publication. So we came to the board, we asked if we could change it. We initially thought we could do it earlier in the day, like 9 or 11, and ultimately we settled on the noon hour because we thought that that gave us that desired outcome where the information is delivered to board members well before the dinner time. So I think overall we are reporting a 24-hour cycle. Whether we use the 11 a.m. cutoff hour, the noon, or the 5 p.m., you're getting a 24-hour number, and we just want to be consistent, settle on a cycle, and just stay with it, so we don't create more confusion while we're trying to streamline and cut down on confusion. So I just wanted to provide that and clarify it.
Madam Chair?
Thank you, County Manager. Supervisor Johnson, go ahead.
Thank you. I believe that staff went ahead and changed the time after we had voted to keep it the same. Since Monday, we have had the cutoff date of 12 o'clock. We are still getting the press releases. We didn't even get a press release Monday. They decided to do away with the press release on Monday completely. And we got the information still late at night. I believe that we need to continue the way we have been going. A 12 o'clock cutoff makes that information that we're giving out late at night useless.
Okay, I'm a little confused. Jenny, can you give us what the motion is right now?
Madam Chair, the motion is to, as he referred to, as you guys voted the other day, was to keep the nighttime press release with the shutoff time at 5 p.m. And that is indeed what the board voted on. I believe it was on the 10th of August to keep the time at nighttime. So he's just reaffirming that.
If the board voted on that and approved it, then why are we doing it again?
I think there, if you wouldn't mind me jumping in here.
Yes,
I think
please do.
our clarification was that we would provide the information for the daily case summaries to go out at the, for the evening report and for the press release. And so ultimately, we were looking at how to try to align those timeframes with the fact sheet that we were providing and those case summaries so that they would match the time frame, so otherwise they would be off also. So we were looking at the timing of the press release, of course, and the daily summary. So I apologize if we've come off track there.
Okay.
Madam Chair, though, you do have a motion and a second on the floor for that motion.
Okay. Any further discussion? Okay, all those in favor, say aye.
Aye. Aye.
Any opposed? Okay, motion passes.
Madam Chair, I still have more questions.
Yes, go ahead.
Thank you, Madam Chair. I noticed yesterday that the fact sheet was posted on Facebook several hours before the board ever got notified. Can we ensure that the board is informed first? I was getting phone calls on numbers that I had no idea what they were talking about.
I believe what happened yesterday, Supervisor Johnson, is that when I send out the fact sheet, that fact sheet is to all of the board, Sam, and the county manager, and to Roger. So I think we need to work on our timing again of how that information is shared out, and making sure that you, of course, have it first, and before that's shared with the media.
Okay. In your daily COVID report, you send us, you break down long-term care cases and deaths. I'm no longer able to find that information. Is this some information that we can still get or have it reported back to the website?
We can certainly look at that, Supervisor Johnson. We never really had it on the website, and those numbers anymore are negligible. Those increases in cases are more a result of community cases and not generally from long-term care facilities any longer.
Okay. As of Monday, the board is no longer receiving our daily hospital report. Can you tell me why that is?
We were trying to consolidate again all the reports, so the information on the hospitals we provided as aggregate information for the county on the county webpage.
Okay, well, before we got actual hospital reports from each one in our district.
Correct. And is that something that you're looking to continue?
In my opinion, we should. I mean, I think it's important, especially since how mine usually has questions about staffing and those issues. I'm pretty sure the other supervisors, they can answer for themselves, but are interested to make sure that their hospitals are not overcrowded.
Did the other supervisors want to receive this information? Supervisor Angus?
You talking about the hospital?
Correct.
Information, we get it. And to me, the hospital information really is the most important, because that is what this whole thing was all about. The possibility of overtaxing our hospitals, which has never happened, at least in Mojave County.
Right.
And for the people out there, we are prepared if we were prepared and are prepared if it ever did. So I get the information I need.
And Supervisor Angus, I have a question. Well, I haven't received this since Monday.
So
I believe I did.
we're referring to the hospital capacity reports that you were getting each day.
Yeah.
Monday through Friday.
I haven't gotten.
Yeah.
I thought I was.
No.
What am I looking at?
Because
then?
we rolled those into the aggregate into the webpage. But we can certainly.
No, that is, to me, and I agree with, and I'm sorry about that. I agree with Supervisor Johnson that I don't know what I've been looking at, but
Okay.
that's very important.
Okay. Anything else?
I got a
Madam Chairman,
Supervisor Gold?
I also believe that the hospital report is important information.
Okay, I'm sure that Denise can get that report coming right back out to us, so thank you.
Certainly.
Just one more thing. I got a text while we were talking, and did you say that the Havasu and Bullhead each are getting 150 tests?
Through North Country Healthcare testing, that's what information I received from North Country.
Okay, because
yes.
in the press release, it says 200.
So that may have increased. That was the information I got from North Country as of early this week. So
So is it 150 or 200?
if, I can only base mine off of what I learned from North Country directly, and that's where I received the information about 150 tests. So I can, again, confirm with them what that test count looks like to see if that's increased for them, but I was not informed of that increase.
Again, important because people have to sign up for it. Right.
Correct.
And one more thing, on the reports themselves, on the press releases, I'm not really sure we designate the time frame like we could.
Okay.
Roger, you know, what the time frame is, or is that kind of impossible given what we were talking about earlier about some of them are immediate and some of them are older? You know, it's kind of, would be very difficult to say, okay, this is definitely from this period of time to this period of time.
Correct.
And that's why we don't. Okay.
Madam Chair?
Go ahead.
Thank you, Madam Chair. I think it would be a lot easier for the public if we did the fact sheet and the press release at the same time, because the press release kind of explains a lot that's in the fact sheet. Because if you go to our health page, I see a lot of people are not happy and can't understand the numbers that we're putting out because the numbers have changed. So maybe if we had them both at the same time, I think one complements the other, and that might help with a lot of the questions.
So just based on what I'm getting from feedback is that the 7 o'clock time frame, if we pull it 5, we could have the fact sheet and the web page updates by 7, and then we would have to, it would take a little bit more time to get you the case summaries. Because that's an additional report we have to run, a separate report that gets run. So we would be looking at probably 7:38-ish to get that all to you.
Well, I just think it would be better for the public if we posted them at the same time, because if you give them something ahead of time with no real explanation and the numbers don't add up, if people go there, they'll see that, you know, people are saying, I'm a math teacher and I don't understand funny math and I don't understand the new math. At least the two together, if we put them both out at the same time, hopefully people will understand what the numbers mean and have more confidence in what we're putting out.
Yeah, Supervisor Johnson, I agree with that. I think they would complement each other quite nicely. So can we do that, Denise?
Again, you wouldn't have the information until about 7:30, 8 o'clock at night.
Yeah, I would be good with that. Supervisor Johnson, is that okay with you?
That's fine with me.
Okay, other board members? Okay, I see no disagreement with that.
Madam Chairman,
Supervisor Gold?
I just had a question for Denise. I crunched some numbers, and it looks like we have approximately 1,050 active cases of COVID in the county. And it looks like about half of those are in the hospital and half of them are recovering at home. So of the approximately 525 cases that are recovering at home, how many of those are in long-term care facilities?
So for the hospitalization data, you said we have 1,000 people in hospitalization?
No, it appears that we have, from the numbers that are on the COVID fact sheet, if you run them out, you have about 1,044 current cases countywide.
Okay, I'm going to need to look into that, please.
Okay. From your comment earlier, it seemed to be that you've felt that those COVID's already moved through all the long-term care facilities.
Yes. Our count within long-term care facilities has gone down. I'm sorry. Go ahead.
But there's still people that are vulnerable in the long-term care facilities that have not developed antibodies. And as people move into those facilities, it's still a risk.
So the hospitalization data that we report on the fact sheet is actually hospitalized at any time. So defined as all persons who tested positive who were admitted to and stayed in a hospital for at least one night. So that's at any time during the course of their illness, not just a point in time, which is what you saw before, which was the disposition at the time that we contacted them.
So the number that we have on the fact sheet is not the number of people that are currently in the hospital?
Correct.
It would probably be handy to know the number of people that are currently in the hospital, and hopefully that what we discussed earlier will show that.
I'm not, we can certainly check into that. I'm not sure if we'll be able to have that information for you, but we'll check.
Supervisor Angus?
Well,
Thank you.
that information is in the hospital report. If we get the hospital report, you can just look at, and you can know at any given time
Right.
how many
The
COVID patients there are in the hospital.
Correct. Correct.
I agree.
Madam Chair?
Yes, Supervisor Johnson.
I think what I'd like to do is make a motion that we put the fact sheet out at the same time as a press release so there's no more confusion with staffing. That would be my motion.
Okay, we have a motion on the floor. Is there a second?
I'll second it.
All those in favor, say aye.
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 Any opposed? Motion passes. Okay, anyone else?
Madam Chairman,
Yes, go ahead.
we may want to change the column that says hospitalized on the fact sheet if it's actually anybody that has been in the hospital. Because I believe it gives the impression that that's how many people are currently in the hospital.
And we do have the definition on the back side of the fact sheet, so if that needs to be somehow clarified differently on the front, we can do so. But we do have on the back side on page 2, under definitions, it does talk about how we include hospitalizations in that.
Okay, on the fact sheet, it
But if we're
says,
trying to give people a quick look at what's going on, they shouldn't have to go to the back page to check the definition of what they believe is people that are currently in the hospital.
so Supervisor Gold, I think that was the reasoning for the definition, so that it would explain exactly what we're looking at. But what it says on the fact sheet is hospitalization defined as all persons who tested positive who were admitted and stayed in a hospital for at least one night. This would not include solely being treated at a hospital or spending time in the emergency department alone. That's what you're,
Correct.
that's what Denise was referring to.
It just says hospitalizations on the fact sheet, though. That's my point. And that leads you to believe that there's 513 people in the hospital currently.
Madam Chair, maybe it's just a labeling issue, so we can just label it.
It's a labeling issue for sure.
All right.
Madam Chair.
Yes, go ahead, County
May I?
Manager.
The fact sheet was intended to take several reports or a compilation of reports and summarize them into one place, one source, and enhance the visual presentation of it so it's easier to relate to and understand. So we're really heading down a path where we have so many now different reports. We will have the press release, we have the fact sheet, we have the hospitalization report, which is released by Lenore to the board members and then released to Roger without certain column and certain information. And I think we're just, and therefore we're introducing even more questions and more confusions, and we're having to define this and define that. I think we're just looking for direction, and I think we're looking for streamlining, if at all possible, to inform the very people that we want to inform. So I'm having a hard time keeping up with the various expectations, the various motions, and the various reports. And so I think we really we want to make sure that we meet the board's expectations and get the information out at the earliest we can in the most accurate way we can. And if you recall, prior to all this discussion, we had two running numbers of cases, and they were nearly 100 cases apart. That was because we were reporting in one report raw data that was accumulating day after day, and another report we were reporting data that had been corrected, vetted, and changed. So I just wanted to really share those thoughts with you, and again, we're here to serve you, we're here to put information out. It's just getting very confusing, at least to us and to me personally. So we're prepared to serve you. We just need to understand what the expectations are.
Thank you, Sam, and I agree with you. This fact sheet was meant to be a summary at a glance, a graphic, basically to put on social media so that our constituents could understand at a glance without reading the news release. But those constituents, like the math teacher, if this is put out along with the press release, then if you want more specific numbers, that certainly gives it to you at that point. And then I guess if they even want to get more specific, they can call their individual district supervisor. That's my thought anyway. Anybody else?
Madam Chair?
Supervisor Johnson.
Thank you. I think you hit the nail on the head there. The only confusion has come from the fact sheet, like Supervisor Gould pointed out. If you go through and look at the comments have not been complimentary towards us on the fact sheet at all. I think, like you said, if we do them both at the same time, that might help. When Supervisor Gould's talking about the hospitals, if you look in the back, not only is it on the back page, it's also in very small print. So I think hopefully the board has made 2 motions today, and I think those motions will help with the problems that we've had in the past. Thank you.
Okay, thank you very much. Anyone else? Madam Chair, Supervisor Angus.
Just a heads up, maybe we can talk about it at the next meeting, but there was one place that we haven't really spoke about, and that is the metrics for opening up and loosening restrictions on skilled nursing and nursing homes. Do you get instructions about that? Because, we're talking about the big complaint is that people can't go see their loved ones. Mm-hmm. And is there any metrics or presentation you've gotten from ADHS to help people understand that? Or is it just...
We have not received any metrics from the Arizona Department of Health Services related to long-term care facilities, assisted living, skilled nursing facilities to date. So at this point, they are continuing to operate as their normal protocols, which is to not allow visitors. I do understand that they are looking for mechanisms, of course, to create video meetings for some of those individuals. I know that can't replace an in-person visit, but I know they're trying to keep their cases and the virus out of their facilities, and they're doing the best they can, and that does usually indicate that they'll have to leave, not allow the visitors in. So, but they have some protocols that are put in place by their own facilities and by ADHS as well. And CMS might be also providing some guidance along with Arizona State, Arizona Department of Health Services licensure offices for those that are licensed facilities.
Could you, get an update and maybe give us a more in-depth on what you find out on Monday, please?
Okay, anyone else before I adjourn the meeting? We're adjourned.